I came to the healthcare field because my mother was a nurse, and I grew up in a very rough environment. I mean, I was literally up in hospitals with my mom from the time I was 5 years old, running and answering call lights for her. She was a single mother for a certain period of time. So I would go and hang up there with her when she didn't have a babysitter, and I would help her. But it was an environment that I was just very comfortable in, and that I felt like I could really do something that was going to impact people's lives. And she became more autonomous through education. And I just remember thinking, they can take everything away from you, but they can't take education, and nobody can take what you know. And so that really then became my pathway out of poverty. And I went into educating other healthcare professionals because I wanted other people to have that same opportunity. Healthcare as an industry has struggled for a long time. On the patient side, you have an aging population, and that takes a lot of nursing care and a lot of healthcare. And on the other side, you also have the nurses and other professionals who are aging themselves, and you don't have enough people to teach the next generation of healthcare professionals. And so there's only so many students that can be allowed into any of those programs. And so this was a problem before 2020. And then COVID just set the whole thing on fire. People were not able to be in the same space together, and they didn't have tools to have remote, portable types of options for them. So those instructors were having to figure out how to make up for that time using simulation in whatever ways that they could. They really need consistent, standardized education that is portable, that is scalable, so that they can make that education available to people wherever they are. And so VR is a tool in that toolbox to offer that type of immersive training in a way that works for people. And I've been in the healthcare sim world for quite a while. I have worked with people internationally and nationally publishing in simulation. I was honored to actually contribute to the International Healthcare Simulation Standards in 2020. VR was around, but it was the new thing, and people can be slow to adopting something that they haven't touched and felt and tried. And then after the pandemic, it has just exploded. It really sort of pushed us to have to use it, and then we realized, oh my gosh, this really checks a lot of boxes that we did not have a tool for before. And so now it's actually a requirement for certification for some roles. It has proven itself to be the most effective way to really ensure that people who are taking care of patients are doing so safely. Transfer has done amazing things in skilled trades with VR, and a community college saw results with using Transfer's educational product, and they had skilled trade programs and then also had healthcare programs. And so they were coming to us and saying, I need you to do for us in healthcare what you have done for us in manufacturing. And that really got the ball rolling, and then Transfer said, okay, let's look at this and see what solutions could we offer. And then talking to over 150 leaders across the country in healthcare and asking them what are the skills that when you hire people you really want to see, and then took all of that data and said, here's where the most people agree the need is. And where that really fell was these entry-level patient care skills. It's taking vital signs, it's helping a patient walk, ambulate, donning and doffing PPE. So it just made sense to start at the beginning, because those skills are very generalizable to many, many roles in healthcare.